semi-automated machines where you need a human interface to control them and operate with them.
Yeah, like doctor, I don't want a robot operating on me. I want you to operate on me.
Would you trust a robot with your life? What if something goes wrong? What if you are lying on an operation table and you witness robots getting ready to operate? Worried? Nervous? Afraid? And that's completely understandable. In today's episode of Second Opinion, we explore the rise of robotic and telesurgeries and whether they are truly the future of healthcare. What if your surgery wasn't done by human hands alone, but guided with a robot with unmatched precision? In today's episode, we discuss how robotic-assisted surgeries and telesurgery are transforming healthcare in India. Robotic surgery offers unparalleled advantages. Enhanced precision through flexible arms that mimic human joints, leading to less pain, minimal blood loss, and patients walking just hours after procedures. Imagine a surgeon in Chennai guiding a hernia repair in Salem without leaving the city. That's the power of robotics telesurgery. From hernia repairs to cancer removals in the stomach, colon, or prostate, robotic-assisted surgery is transforming specialties like orthopedics, urology, and oncology. Imagine living in a small town and getting operated on by one of India's top surgeons without even being in the same room. Sounds like science fiction? Robotic-assisted surgeries are transforming operating rooms worldwide, offering precision and faster recovery times. But as their use surges, so do concerns about costs and limitations. The data on robotic-assisted surgeries across the globe shows a rise of these procedures, with robotic systems like the Da Vinci leading the charge. In 2021, 1.5 million minimally invasive robotic surgeries were completed, and in 2024, that number hit 2.68 million, a staggering 18% increase year over year. Experts project robotic surgeries could exceed 10 million annually by the end of 2025, now accounting for 15% of all surgical procedures globally. Here in India, the robotic surgery revolution is gaining momentum. Since the first Da Vinci system arrived in 2002, adoption has skyrocketed, especially post-COVID. It is not just private hospitals, but even the government hospitals in states like Tamil Nadu have adopted robotic systems for surgical procedures. As of 2024, over 60,000 robotic-assisted surgeries are performed annually, making up 30% of procedures in fields like urology and gynecology. Between 2006 and 2019, 12,800 procedures were completed across 66 centers with 71 robotic systems. The indigenous SSI Mantra robot marked a milestone in 2023, completing 100 successful surgeries in just 6 months. With specialties such as urology, orthopedics, and gynecology seeing a demand, innovations like SSI Mantra, Da Vinci, and Vercius are making these procedures more accessible. The future of healthcare in India is nothing short of revolutionary. So we have seen that robotics has become a key segment of the healthcare industry. Now when we talk about robotic assisted surgeries, and we've seen that the telesurgery, robotics assisted telesurgery is also emerging. We've seen an expansion. How do you see the scope of robotics, especially the telesurgery, in India?
So telesurgery has been started mainly with the purpose of making sure that expertise reaches people even in rural areas, because we cannot have the surgeon with the most expertise in all places at the same time. The good thing about telesurgery is, say for example, we are in a major city and somebody in a rural part is doing a surgery and they need some help, they need maybe proctoring or they need somebody to do the surgery. We can pitch in from being in Chennai to a rural area.
But overall, when we look at it, what are the infrastructure-wise the developments that are key in robotic surgery?
We will be able to take control of what they are doing from a remote location. But for this to be done, we need to have the exact same robotic system in Chennai and in the rural area wherever the other person is practicing. very good internet connection, and a very stable, all the systems which are needed for infrastructure, basically needed for carrying this out. Because we recently performed a telesurgery from Chennai to Salem, which is 340 kilometers apart, I think 2 weeks ago now, and it was the first in India to be done between two hospitals. There was absolutely no lag, and the people who were sitting in Chennai by the patient told us that it was as if we were sitting in Chennai and doing the surgery. So, yes, this has tremendous scope because it gives us the comfort that even if somebody is in trouble or they don't know what to do next, or if it is a difficult situation in another part of the country or anywhere, if they are connected via the robo, we will be able to guide them or take over the control and do the surgery ourselves.
But it's not just the robots. Artificial intelligence is stepping in to complete the larger picture. AI helps reconstruct anatomy from scans, anticipates surgical challenges, and ensures safer outcomes. Despite the hype, misconceptions persist. Patients often worry, will the robot operate on me? The truth is, surgeons control everything, sitting just feet away.
Let's say, for example, I'm performing a surgery of removing a cancer in the stomach. So I will first do an imaging study, which is usually a CT, and find out the imaging, and using AI I will reconstruct it so that it basically pops up on a system where it will show the exact structures in the exact region where the cancer is at. So knowing this, I will be able to map it, and I will know exactly how to approach it, what blood vessels are coming, what difficulties to anticipate.
As experts explain, it requires identical robotic systems like the Indian-made SSI Mantra 3.0, stable high-speed internet, and robust infrastructure on both ends. The goal? Delivering expert care to rural patients, reducing travel, and ensuring precision with zero lag.
See, robotic surgery has been very famous in the West for almost 15-20 years now, and it's been rapidly increasing in presence in India, so much more in the last 5 years. The main advantages of robotic surgery is early recovery, less pain to the patient, reduced blood loss, and the precision with which we do surgery. See, surgery has evolved from the age of being open surgery to laparoscopic surgery to robotic surgery. In open surgery, which was considered the gold standard at that time, which is still probably considered the gold standard, where you can directly see the tissue, feel the tissue, and perform surgery. The next step was laparoscopic surgery, where we inserted instruments through the up to small holes in the abdominal wall and performed surgery. That improved the outcomes because patients were up and walking even a few hours post surgery, and the pain was so less. The results were tremendous. Robotic surgery is now something where the precision is even better, and the outcomes are good. Like, I've seen patients walk 2 hours, 3 hours post robotic surgery, and they don't even feel like they've undergone any surgery.
Telesurgery also holds promise for rare and complex cases via public-private partnerships, though challenges like setup costs and infrastructure remain. Teleproctoring adds another layer, allowing remote guidance and training for surgeons.
The limitations of the human hand is that it's very difficult for operations to be performed in very small or tight areas, or inside the abdominal cavities or inside the chest cavities. So to approach these areas, we need to make very large, huge incisions. Even the smallest organ inside the human body, such as the gallbladder, appendix, or prostate, require very large incisions to remove them or to approach them for any surgical procedures. And that's where robotic technology came in. Though laparoscopic technology existed well before robot evolved, the challenges of doing laparoscopy was that very fine procedures inside the human body had to be done with very long instruments, and you need absolute masterly control to perform these fine procedures. And that's where robots came in. Can the robot do it on itself? No, it's an absolute no. The robot won't move without the human interface. The robot on itself will not even move a millimeter without the doctor's control.
Experts also note that costs do not vary extensively and are often covered by insurance. Additionally, the success of these procedures hinges on skilled teams, from doctors earning certifications to nurses mastering troubleshooting. It's a collaborative effort. Setup times can extend surgeries by 30 to 60 minutes, and surgeons face a steep learning curve. requiring over 20 hours of training. Challenges include high capital investment and trained staff intensity. But how are hospitals handling this? Let's understand it better from the experts.
However, this technology comes with a price, and we need a platform called the robotic platform to perform these procedures. There has been a growth in the robotic platforms company, and many more companies are on the way, and hopefully in the near future the cost of the robotic surgery is going to drop very soon. To overcome the challenges of training and the availability of robotic in tier 3 cities, the newer robotic platforms have come with telerobotic capabilities. With the telerobotic facilities and the newer robotic platforms come in, that's not going to be a difficult one in the near future.
Despite expansion, the robotic systems access remains limited to specialized centers, raising equity concerns. However, experts urge patients to weigh down these factors with their surgeons, as robotic surgery's benefit depends on the procedure and expertise available.
Traditionally, surgery used to be done open surgery. We moved to minimal access with laparoscopy. In the last 10 to 15 years, robotic surgery is becoming standard of care in many specialties. But challenges do remain, particularly because of cost. But with the advent of newer robotic systems, the cost of robotic surgery is coming down. So it becomes very important to set up good robotic surgery programs where specialized care is delivered at a very economical price. That way, more patients can access good quality surgery with robotics across the country. So the advantages are very clear. With specialized care, patients get better outcomes, and with robotics, these outcomes are exemplified. So in the years to come, there will be more systems, better surgical programs which will incorporate these systems and provide surgical care at a very economical price, which can be accessible to many patients across the country.
As we close this episode of Second Opinion, it's evident that robotics and telesurgery are not just transforming healthcare, they are redefining what's possible. From rural clinics to urban hospitals, these innovations have the potential to revolutionize healthcare across India.